Hello everyone and welcome to our capstone presentation. My name is Becky VonWahlde and I did my senior preceptorship in the emergency department at Providence St. Peter Hospital.
And my name is Abigail Terry. I did my senior preceptorship in the intensive care unit, also at Providence St. Peter's Hospital. The title of our capstone presentation is The Critical Care Nurse's Role in End-of-Life Decision-Making.
In terms of what prompted our interest in this topic, during our preceptorships, we noticed that there was a lack of conversations surrounding planning for the end of life. We also witnessed patients receiving non-beneficial treatments. These are treatments or interventions that are not projected to improve the patient's quality of life or their prognosis, and in some cases may even extend patient suffering. We wanted to explore the role of the nurse in these situations and how they can provide a positive impact.
During our research, there were many things that surprised us. However, there were two main points that really stuck with us. The first was the lack of advanced care planning for adults in the US. One study we found said that 60% of people want their end-of-life wishes honored. However, only a third of that 60% actually had any kind of advanced care planning in place. This is important to mention because advanced care plans allow the nurse, the doctor, the rest of the healthcare team, and the patient family to make sure that every decision they're making is honoring patient wishes. The second point we wanted to include was that critical care nurses are often excluded of end-of-life discussions and end-of-life decision-making. This was disheartening to us as nurses are often the person or the people closest to the patient and the family, and therefore the most apt to relay patient wishes to the rest of the healthcare team.
Our research reinforced the need for nurses to be involved in the end-of-life decision-making process for their patients. As Abigail touched on, nurses are often the member of the healthcare team who is closest with the patient and family, and they are able to act as a trusted resource. They are able to advocate for their patient's best wishes by assessing what the end-of-life wishes that the patient has are and ensuring that they're implemented into the patient's plan of care.
Also, while doing our research, we were able to relate a lot of what we were finding to things that we were able to see during our time in our practice environments. There are three main things that we really saw a lot of when dealing with end-of-life patient cases. The first is the use of non-beneficial treatment. In a study included in our capstone, it says that 33 to 38% of patients receive some type of non-beneficial treatment at the end of their life. These treatments can include the initiation of CPR, and admission to the ICU, dialysis, antibiotic therapy, and more. And we, upon reflection, realized that about that percentage and maybe a little more of our end-of-life patient cases were receiving some kind of treatment that wasn't really going to help them improve their quality of life. Another thing that we saw a lot of in the hospital setting was the view of dying as a failure rather than a progression of how life should go. This view of dying as a failure and a failure of the healthcare team and the patient's family prevents honest communication between those three parties. And this prevention of this communication and being open and honest doesn't allow the patient to have the best outcomes. And then the last and one of the most important things that we saw in practice and really got us excited about starting to do this presentation were nurses that were not feeling invited to start end-of-life discussions or have the end-of-life discussions or include themselves in any decision-making process. Again, as we've mentioned before, nurses are very well suited to relay patient wishes and have these really important discussions and use therapeutic communication with patients and patient families.
One point that we would like all of you to take away from our poster is that the role of the nurse in end-of-life decision-making is to facilitate conversations and advocate for the patient wishes. One way this can be done is through the use of interdisciplinary conferences, which should include the patient, if possible, their family, including anyone who has been designated as medical proxy and will be making decisions in case the patient is incapacitated and unable to do so for themselves. The healthcare team should also be included, and that, most importantly, includes the patient's nurse. Another key takeaway is that as healthcare professionals, we should ensure that our patients have expressed their end-of-life wishes, and if not, encourage them to do so, regardless of the clinical setting you are seeing these patients in. We also want to encourage each and every one of you to think about what you would like to receive as your end-of-life care and to make these wishes known to your close friends and families, as well as looking into putting these decisions into writing via an advance directive.
When we first did this presentation with a group of our peers, a question that was posed to us was, what is the main role or the most important role of the nurse in end-of-life decision making? As a nurse, what can we do to really help this process? And while there are many pieces to this puzzle, the main thing we want to relay is developing a trusting relationship. Developing a trusting relationship between the nurse and the patient's family allows for an open and honest communication between all three of those parties. And that open and honest communication allows us to talk about really sensitive subjects such as end of life or death and dying. And we just want to give a special shout out to a couple people here, to our clinical preceptors, Michael Smith and Tracy Holcomb, our clinical instructor, Kelsey Pasco, our capstone professor, Dana Zeichkin, our cohort, our friends and family who have supported us through this journey, and anyone else who was there for us along the way.
And thank you to all of you for taking the time out of your day to watch our capstone presentation. We really hope that you were able to take something from our poster and that you'll be able to apply it to your future practice. Thank you so much.
Thanks.